So the most commonly reported pelvic floor dysfunctions after gynecological cancer are dyspareunia, urinary incontinence, and fecal incontinence. In non-cancer populations, there's moderate to strong evidence for pelvic floor muscle training for these. However, gynecological cancer survivors may respond differently due to the sequelae and consequences of cancer and cancer treatments. So our aim was to identify the effect of pelvic floor muscle interventions for symptoms of pelvic floor dysfunction for gynecological cancer survivors. We found 5 randomized controlled trials that included pelvic floor muscle training and 2 retrospective cohort studies that included vaginal dilator training. The quality of the RCTs was low to moderate on the Pedro scale, and the quality of the cohort studies was moderate on the Newcastle-Ottawa scale. Due to differences in treatments, only 4 studies were meta-analysed. So our results will be presented in forest plots. The results of each individual study are shown by the coloured box, and then the diamond represents the pooled effects. The black line across shows the confidence intervals. So in this first slide, positive effects are on the right side of the graph. So 2 studies investigated pelvic floor muscle training and core exercises or yoga. You can see here that one study clearly shows a positive effect, while in the second study the confidence interval crosses the midline, meaning it was not statistically significant. The pooled effect, however, does show a significant improvement in health-related quality of life. One study investigated quality of life after pelvic floor muscle training, electrical stimulation, and psychological education, and you can see that the results clearly show a significant improvement. For sexual function, positive results are on the left side of the graph. So the individual study results and the pooled results here all show positive effect on sexual function after pelvic floor muscle training and core exercises or yoga. One study investigated sexual function after group sessions that included pelvic floor and dilator training advice, and you can see that the results are in the middle, showing no effect of that specific intervention. Individual studies did not find significant improvements in bladder and bowel function, as you can see by the confidence intervals all crossing the midline for those outcomes. This forest plot of odds ratios shows the effect of vaginal dilator therapy. So you can see that participants who used dilators at least twice a week had lower rates of severe vaginal complications, with the study results on the left side here favouring the intervention. So there is moderate evidence that pelvic floor muscle training and core exercises or yoga improve quality of life and sexual function, and very low evidence that high-frequency dilator training reduces the rate of severe vaginal complications in women who've had treatment for endometrial or cervical cancer. More research, especially on bladder and bowel function, is needed to provide guidance for clinicians and health services. Thank you.
Thank you, Robin. Questions on the systematic review? Thank you, Jodie.
Jodie Daykick from Melbourne, Australia. You just mentioned the severe vaginal complications at the end, and I just wondered what you meant by that.
So severe vaginal complications in the 2 dilator studies were defined according to the Common Terminology Criteria for Adverse Events, version 4.0. So they could include vaginal mucosal toxicity, so inflammation of the vagina to the point of ulceration or impairing with a woman's ability to self-care, vaginal stricture with narrowing or shortening that prevented tampon use, penetration or examination, or vaginismus that prevented tampon use, penetration or examination. There are a few others, there's a whole page worth of them, but that's about the level of the severe vaginal complications.
Mariana Alpern, University of California, San Diego. I just have a question. These people that were involved in the studies that you included, did they have pelvic radiation, or was it just surgical treatment of the cervical or endometrial cancer?
There were a variety included. In the vaginal dilator studies, they included people who'd had surgery plus radiation. In the randomized controlled trials, The majority included people who had a variety of treatments. So they had some surgery-only participants, some surgery and radiotherapy, some surgery, radiotherapy and chemotherapy. I believe only one study included surgery-only participants. So it was quite a heterogeneous cohort from the treatment of cancer perspective.
And in those studies in themselves, probably not possible to do in the review because there's only 4, but was there any difference with the respect of pelvic floor muscle rehabilitation in the patients who do and do not have pelvic radiation? Because I could imagine that it would be quite different.
Unfortunately, they weren't large enough to actually identify that.
Right. Thank
Merete Tenfyr, Oslo, Norway. I was just wondering about, because pelvic floor muscle training was never by itself in these studies. It was always
correct.
combined with the others. And I guess this difference if it was supervised or not. And also that sexual function was just everything.
Yeah, the sexual function outcome measures were usually the female sexual function index was the most common outcome measure. So that does include other factors such as arousal and anorgasmia and those aspects of sexual function. So we can't just pull out dyspareunia from that. That's correct. What was the first part of the question?
The first part was, I guess, the pelvic floor muscle training was never measured by itself. So it's always combined with the others. And if it's supervised or not, I guess that also differs.
Absolutely. There were no studies of pelvic floor muscle training alone. The supervision levels did vary slightly. So one of the 2 studies in the meta-analysis, they provided 4 sessions of supervised pelvic floor muscle training at weekly intervals. Another one provided 1 session in person and then a phone review a month later, but still called it a 12-week program of pelvic floor muscle training. So there are very significant limitations, and we do need a lot more high quality and specific studies in this area to be able to find high-level evidence.
Yeah, I guess also because of the cancer survivors, that maybe there's a need for more follow-up, all of the psychological aspects of the whole survivors. Yeah.
Agree, absolutely.
Thank you, Robin.